Hello, good morning. I'm Dr. Mutiu from the Oncology Department, University College Hospital, Ibadan. Today is an International Day on Cancer. So it's a World Cancer Day, and we usually celebrate it on the 4th of February every year. And the theme for this year is Close the Care Gap. And the aim is to create awareness, to educate people about cancer and how we can work against the disease. So it is being celebrated worldwide. So to make noise, to create awareness, to teach people to come out when they notice any abnormal growth on their body. When we talk about risk factors in cancer, we talk about genetic. Right? It's like a loaded gun. Right? Then we now have environmental factors. Environmental factor is the one that usually trigger the genetic index. So one of the risk factors of cancer is genetic susceptibility. Right? We don't have environmental factors. So under the environmental factors, we have so many other factors. We're still going to discuss that one as we're going on. Right. So some are caused by virus. For example, human papillomavirus is a risk factor to cervical cancer, while BRCA gene is a risk factor to breast cancer. So we have genetic, environmental factors. Almost all are genetic, but some are still, as a result of infection with human papillomavirus or virus generally. Right. Not only cervical cancer that have human papillomavirus. We have other viruses too. Hepatitis can also cause hepatocellular carcinoma. So we have so many viruses like that can lead to the cause etiology of cancer. One of the risk factors again is increasing age. For example, in breast cancer or prostate cancer, we mentioned genetic susceptibility. Increasing age is also a risk factor to cancer. Right, then being a man is a risk factor to prostate cancer. Being a woman is a risk factor to breast cancer. Though breast cancer occurs in both men and women, but we have it more in women. So being a woman is a risk factor to have breast cancer. Breast cancer is more common among the women. Right. So, and for breast cancer, we talk about some risk factors that we talk about genetic susceptibility, the BRCA1 and 2 gene. We talk about age. We talk about previous history of fibroadenoma or lump in the breast that is usually not painful, but progressively increasing in size. So we talk about other things like maybe use of contraceptives, smoking, alcohol, right, that are risk factor to this. And how do they present? Like we said, breast cancer is the commonest among the women. Although the importance about this is that among all the cancers, breast cancer still has highest number of survivors, despite the increase in incidence among the women cancers. And some patients will present to the hospital with lump in the breast. They can have lump in the breast, which is very painless. And that's why most people don't come to the hospital. Because if it's painful, they will quickly run to the hospital. But when it's painless, usually progressive discharge can be associated with nipple retraction. Patients can have nipple retraction or nipple discharge, nipple obstruction of the breast when it has become advanced. They can also present that with features of spread of that disease if the disease has moved from one part of the body to the other. For example, if the disease has moved from the breast to the brain, they can have headache, vomiting, nausea, even blurring of vision. If it has moved to the lung, they can cough, chest pain, and difficulty with breathing. If the disease has moved to the liver, yellowness of the eyes can occur, body itching, body rashes. If it has moved to the bone, they can have bone pain, they can have weakness of the bone, they can have paraplegia, inability to walk. So these are the way patients present to the hospital. For cervical cancer, patient can have bleeding. Somebody that is not menstruating that is bleeding. It's one of the features of symptoms of cervical cancer, or intermenstrual bleeding. Right, these are the things, or watery discharge, or even pelvic pain. So they can come down with these symptoms. And among the women, we have breast cancer in this part of the world. We have cervical cancer. But for men, we have prostate cancer. If you see a man above 60 years with difficulty with urination or hematuria, we must have high index of suspicion that may likely be a prostate disease. When I mention the issue of risk factor now, I mentioned two major factors. I talk about genetic index that serve as a loaded gun, and I talk about environmental factors. In the environment is what we call all these things that we mentioned: exposure to radiation, exposure to chemicals, diet, high fatty diet, smoke process or smoke food. So these are the one. Even inactivity, obesity, right, overweight. These are the things. So when we now talk about, we can even categorize this factor into modifiable, non-modifiable. The modifiable one are the one that we can adjust. Let's encourage us to do exercise. Let's take more fruit and vegetables. Let's take high fiber diet, because in some cases you can have low fiber diet that can lead to some type of cancer. So activity, reduce fat intake, reduce smoke or processed food intake, or do in moderation. There's no reason for us in Africa to drink alcohol or smoke, right? Because we know that it can lead to this disease. So lifestyle modifications can help a long way, right? So if you can change that lifestyle, you can stop smoking, stop taking alcohol, healthy diet, exercise. These are the ones that can really help us. Now, the one that is not modifiable are the age, genetic index. So we talk about some cancers that are preventable, some that cannot be prevented. Then you can early diagnosis is the key. When it is diagnosed early, you can eradicate it. But we know that no one can prevent, like for cervical cancer. We know the major culprit in cervical cancer is human papillomavirus. So for this now, we have vaccine for that. We encourage people to go for the immunization, especially between age 9 years to 26 years can take the vaccine if they are not sexually exposed. People that are sexually exposed, you can tell them do the pap smear or liquid-based cytology. If they are negative, then you can go for the vaccine. Vaccine is very, very important because it will prevent, it can reduce the risk of this disease. Not only cervical cancer has vaccines, we also have hepatitis vaccine that can prevent all this hepatocellular disease. Not only that, we have other ones that they, for example, nowadays they talk about the COVID vaccine because of the COVID virus. It's important for us, once they have immunization schedule, it's important for us to go for immunization schedule. They do it in children, but adults can also go for vaccines. Yellow fever is also there. Vaccines for yellow fever there. We have meningitis, cerebral meningitis. It's also have vaccines. Tetanus also has vaccines. So whichever one that has vaccines, especially that can prevent the cancer disease, then we encourage our people to go for it because those are the preventive measures. It's very common for cervical cancer. Our women must go out and do the immunization. It's very, very important. Because if the virus is there, even before the virus comes in, if the vaccine is there, it can reduce the risk of this disease. So vaccination is very, very important. It's one of the preventive measures. And you need to make notes to tell people to go out and do check. Apart from the vaccinations, we talk about check. For breast cancers now, we talk about mammogram above 40 years of age. People that are below 40 years but have family history of breast cancer can do their mammo before 40 years. People that have no family history can do sonomammo, right, to check their breast. And then examination of the breast is very, very key. We talk about examination of breast for premenopausal people that are still menstruating, reproductive age, they can do their own 10th day of their cycle. If the cycle is 1 to 28 days, 5 days is usually menstruation period. Then 10th day of the cycle is usually best to do the examination of the breast so that you don't miss it. But people that are not menstruating again can pick a particular day in a month to do their breast examination. For cervical cancer, we talk about pap smear or liquid-based cytology. It's very important for us to go for it, especially people that are sexually exposed. It's very key to go for pap smear. So, like that, for colorectal, we also have schedules of screening tools for all those ones. But people need to go to the hospital so that they can get awareness. If anybody notices anything in their part of the body that is abnormal, it is important to go to the hospital. Don't look at, especially with which is not painful. When it's not painful, we don't even mind. We'll just believe, since it's not paining me, there's no problem. But it can cause trouble. I'm a radiation and clinical oncologist. Right. What radiation and clinical oncologists do is to use radiation and medical to treat cancers. And thank God for this OA that people can, instead of people running eta, they can just get into the app and then look for the specialty they want. It's very easy, and then once they log on it, they can easily get it. And then apart from being a radiation and clinical oncologist, other people, specialties that also manage cancers are surgical oncologists. We have surgical oncologists, we have medical oncologists, but in this part of the world, we have surgical oncologists and radiation and clinical oncologists. Surgical oncologists can be surgical oncologist for breast, surgical oncologist for cervical cancer. So it is very easy to just check wherever you are in the world. You can just log in, and then you see wherever specialty you want to go to or to have consultation with. I'm Dr. Mutiu. I'm a radiation and clinical oncologist with University College Hospital Ibadan, University of Ibadan, and you can also find me on OA Online.